Hi, good morning. My name is Meredith Berkson, and I'm the Director of Policy and Systems for the Los Angeles Homeless Services Authority. I'm here today to talk about the LAHSA, or the Los Angeles Homeless Services Authority, also known as LAHSA. That's our acronym. And I'm here to talk about our COVID-19 recovery plan, and specifically both how we responded to the pandemic as a homeless service delivery system here in Los Angeles and as the COC lead, really leading that effort. And then talk about how we are planning to recover from, to continue to provide life-saving services during this ongoing pandemic, but also to talk about how we hope to recover, both financially and from a public health standpoint, for our most vulnerable neighbors experiencing homelessness here in Los Angeles County. So I will go ahead and share my screen to begin my presentation. And apologies. So today I will be talking about, and let me do this. Today I'll be giving you an executive summary of our COVID-19 recovery plan. I'll talk a little bit about our guiding principles, talk about CES refinements or coordinated entry system refinements we've done in Los Angeles to be able to implement the COVID-19 recovery plan. And then finally, I'll talk about our Project Room Key transition. So the COVID-19 recovery plan is a comprehensive plan to rehouse 15,000 of the most vulnerable people experiencing homelessness in LA into housing. This 15,000 number really came from our estimation of how many people experiencing homelessness in Los Angeles County are COVID vulnerable, according to Center for Disease Control or CDC guidance. That's people who are over 65 or who have an underlying chronic health condition that makes them susceptible to severe consequence or even death from COVID-19. Obviously, we're still in a global pandemic, and rehousing our at-risk population both helps break the curve of COVID-19 and can save the lives of thousands of people. The recovery plan builds on the success of sheltering over 7,000 people during our coordinated city-county response to the pandemic by providing sustainable housing solutions for people experiencing homelessness who are the most vulnerable to severe complications. So in our Project Room Key, this 7,000 number represents both our Project Room Key effort, where we stood up over 4,000 hotel rooms throughout LA to address the pandemic in just a very short time. And then also our isolation and quarantine sites that we partnered with the city and county to be able to stand up. So our guiding principles for this recovery plan essentially are to ensure that no one sheltered through our COVID-19 efforts should return to the street. We really saw amazing collaboration and the very rapid sort of standing up of interim housing options, specifically non-congregate sort of COVID-safe interim housing options during our pandemic response. And we need to ensure that no one returns to the streets. We want to quickly house 15,000 of the most vulnerable people in Los Angeles, as I mentioned. We want to curb inflow into homelessness, both by working with our mainstream partners and also identifying and providing resources to people most at risk of becoming homeless. We want to prepare the system for future crises. We really felt the capacity challenge of both standing up Project Room Key and then transitioning into our COVID recovery plan, and the sort of capacity challenges and disaster response has been very difficult on our provider network and on our system. So ensuring that any future crises, we are sort of as prepared as possible. And then we also want to ensure a racial equity lens in all of our efforts. We know that both in Los Angeles, 9% of the population in Los Angeles County are African American, and African Americans represent over approximately 40% of people experiencing homelessness in Los Angeles. So people of color are already disproportionately represented in our homeless population. And we also know that people of color have worse health outcomes from contracting COVID-19 and have had higher rates of mortality. So we really need to ensure that as we recover from both this economic and public health crisis, that we don't exacerbate things that push specifically people of color into homelessness and into severe sort of health outcomes. Our COVID-19 recovery plan is moving in two phases. So we're leveraging at this point funds from the Treasury, the Corona Relief Funds, ESG CV funds from the CARES Act, as well as our local measure H revenue source, which is a quarter-cent sales tax that generates revenue specifically to address homelessness. We're using all of these funds to essentially do a massive one-year lease-up effort or housing surge, where we put everybody into housing, into permanent housing, or as many people into permanent housing as possible, and then essentially use a progressive engagement model to identify what exit pathway is most appropriate for those individuals. So participants with the highest acuity will need to be transferred to supportive housing and will be transferred from their permanent housing unit into a PSH subsidy or PSH unit if it's project-based as these become available. Others will be transferred to a long-term shallow subsidy program. So essentially an ongoing $300 to $500 subsidy that can help people cope with the lack of affordable housing in Los Angeles. We also intend to have people with lower acuity needs exit through the sort of typical rapid rehousing tapered rental subsidy, where they continue to increase the amount of rent that they're covering themselves up until they exit the program and assume full rent. And then some participants we anticipate will go directly into a shallow subsidy. With the funding received from the county and the city of Los Angeles, LAHSA will house approximately 4,700 people. We still aim to house the 15,000 people experiencing homelessness we identified and who are most vulnerable to COVID-19, but this will require additional funding, which we're continuing to advocate to our government partners to provide. We look forward to working with the city and county, as well as the state and federal government to secure these funds as we move forward. So next, I'm just going to talk a little bit about our CES refinement. So as I mentioned, one of our core guiding principles in this effort has been to move people into permanent housing as quickly as possible. And in order to do that, we really determined that there were several refinements our system needed to make to move at the pace that a pandemic and frankly, the crisis of homelessness requires. Prior to the pandemic, Los Angeles or LAHSA and our partner, we hosted a series of coordinated entry system refinements with both our single adult, youth, and family lead agencies. Oops, sorry, technical difficulties. But we met with our providers to hear about how the system is currently functioning in Los Angeles and how we can improve the system. Many of the things that were raised in those refinement workshops, we intended to roll out in February of this year, basically right when the stay-at-home order was released, late February, early March, right when the stay-at-home order was released. So we put a lot of those efforts on hold while we stood up Project Roomkey. As we pivoted to this recovery plan, which again really works to ensure that no one in Project Roomkey or other COVID specific housing exits to the streets, and that people are able to quickly access permanent housing, we really saw this as an opportunity to implement these refinements in this expedited context. So several refinements are in the process of being made to, again, assure success in our recovery plan and in our effort to get people safely permanently housed as quickly as possible. One is active inventory management and matching to recovery rehousing slots. So in our coordinated entry system, recovery or rapid rehousing is not currently matched through the coordinated entry system. We have contracts with individual providers. Those individual providers are tasked with serving the region and not just their own clients. But essentially, we don't match to these resources in coordinated entry. And part of that is because we are our rapid rehousing contracts aren't like typical slots like you see in PSH, where it's a resource that you match to an individual. Our contracts are cost reimbursement based, and so the number of individuals served can vary depending on things like how much the rent is, and how much a provider actually spends per client. We are in an attempt especially to fully leverage the Corona relief funds provided by the Treasury that expire December 30th. We're actively looking at our contracts, identifying underspend in real time, and matching additional people to those slots of permanent housing freed up through underspend. This is again to maximize contracts and to surge housing placements, but I think represents a very exciting opportunity for Los Angeles to look at how we might be able to match more resources through our coordinated entry system to those most vulnerable. Number two is dedicated and matched housing navigation and use of outreach for navigation. So just to be clear, because I know housing navigation can mean different things to different communities, we're really talking about here the people who are essentially tasked with assisting the most vulnerable people experiencing homelessness, who are most likely to be matched to permanent housing and specifically permanent supportive housing, helping those people both obtain documentation, connect to benefits, but also just to know, to have someone as a point of contact in HMIS so that when we match this very vulnerable individual to housing, we can call their housing navigator and say, hey, it's finally time for Jane to be matched to housing, and that housing navigator will know where they are, will ideally have that person have that person's IDs secured, social security card secured, and uploaded into our homeless management information system, and that person is ready to move into permanent housing. This housing navigation also assists with housing location and housing applications, so unit viewings, which obviously are more complicated in the COVID environment. But this is really an essential function to ensure that people can move into housing as quickly as possible, and that we can serve the most vulnerable folks. So we added 38 housing navigators to our system throughout our county, and these housing navigators are matched to people essentially who are next to be matched to recovery housing. Number three is more robust regional coordination and case conferencing. So we're really leveraging in each of our service planning areas. So Los Angeles is broken up into 8 service planning areas, and each service planning area has a coordinated entry lead for single adults, youth, and family. And we are working specifically with the single adult regional coordinators in each SPA to really work to ensure that these minimal resources are targeting the most vulnerable people, and that we're looking at a host of vulnerability factors, including the BI-SPDAT, but also COVID vulnerability factors in partnership with our Department of Health Services, sort of tiering out the level of COVID vulnerability people have, as well as the use of the 5x5 tool and some of the questions from that specifically get at people's functional impairment, either because of substance use, mental health, or a primary care or physical issue. Number 4 is that we needed to create a mechanism to move people to different service pathways. So as I mentioned, this massive sort of phase 1 effort to move people into housing with a time-limited subsidy, and then to identify their ultimate exit pathway, is a really critical thing in Los Angeles, and I'm sure in other regions too, to be able to determine not at the front end necessarily, but once someone is in housing and has stabilized somewhat, whether they ultimately need permanent supportive housing, maybe they even need a higher level of care, or whether someone you might have assumed that who needed permanent supportive housing actually is able to sustain housing through their own sort of means once they get into housing and begin to stabilize. So this mechanism to be able to both upstream and downstream people into the appropriate level of care once in housing is a really critical component of the recovery plan, and again, one that we hope to scale to our entire system. We also have really engaged mainstream systems. This is number 5. So our Department of Public Social Services, which is our welfare administering entity, has been co-located at our Project Roomkey sites. They've been critical in being able to establish people's benefits, including our general relief, our welfare, CalFresh, and Medi-Cal. We've also partnered with Department of Health Services to build out a very robust testing strategy. We've worked closely with Department of Mental Health and our Substance Abuse Prevention and Control, as well as Department of Public Health, to ensure that all of people's sort of immediate needs are able to be met in Project Roomkey, but also as people transition to housing. Number 6 is scaled and centralized unit identification and acquisition strategy. So Los Angeles, I'm sure, like many other continuums and folks out there listening, is an incredibly tight rental market. It's very costly here. Our vacancy rate is approximately 2%. And what we saw when Measure H really rolled out is that sort of an influx of housing subsidies in our market can actually drive the cost of living up, or the cost of rent up, because we're essentially competing against, every other person. People experiencing homelessness are competing against each other in a very tight market, but we're also competing against other people, and that need just drives up the cost of living. So we really wanted to be intentional about how we centralized unit acquisition. And so our negotiation with landlords could really be, again, centralized, and that we didn't inadvertently drive up the cost of living, especially in this financially challenging moment. We also are piloting more of a similar to a master leasing strategy, but instead of master leasing, it's a master rental assistance agreement that mitigates both the liability for the provider as well as for the landlord or property owner, to ensure that we can secure more units at a cost-effective rate. And then last, we really, as I mentioned, want to ensure that we're using an equity framework to actively monitor enrollment and outcomes. Again, we want, in applying an equity framework, to be able to ensure that we are not exacerbating any of the inequities that we've already seen in the homeless service delivery system, in the disproportionate representation of Black people experiencing homelessness in Los Angeles, but also in the extremely, disparate health impacts of COVID for people of color. So we want to ensure that we're not exacerbating those, and we are doing our best to actually mitigate those factors. So lastly, just to talk briefly for those of you who also have Project Roomkeys and are transitioning those Project Roomkeys or demobilizing them, taking those sites offline. We have begun transitioning our Project Roomkey participants. Actually, at this point, over 800 rooms have come offline. We have a 3% exit to unsheltered destinations, which is really an amazing sort of testament to the intensive work that's been happening through case conferencing as sites come offline. We've seen a steady increase in the number of people who are exiting from a Project Roomkey site that's coming offline directly to permanent housing, and are currently at 37% of people exiting to permanent housing, with the remainder exiting to another interim housing site, whether a motel voucher, another Project Roomkey, or another interim housing site, while they continue to work on permanent housing resources. We're taking approximately 400 to 1,000 rooms offline a month, trying to be as sensitive as we can to sort of regional intensity of these efforts and the ability to absorb the number of placements that we need to make in order to have no one exit to the street. Again, you've heard me say it many times in this presentation, but we do not want any participant in Project Roomkey to return to the street. We're working with each person individually and with providers at a more sort of macro level to ensure that every person has a successful service pathway and an exit to permanent housing. So just one thing about our ramp down model, and this is my last slide. So I mentioned this robust case conferencing effort that's happening to really ensure that everybody is assessed that we are determining the most appropriate permanent housing placement for them. Initially with the intention to be able to help people exit to the most appropriate exit pathway. We're supporting people to obtain necessary documentation and to link them to appropriate permanent housing. Stage 2 is really right at the 6-week mark before our project room key end date. And during this period, the hotel stops accepting participants, so no new participants enter at that point. LAHSA, Department of Mental Health, Department of Health Services, the site provider, and the coordinated entry system lead begin a cross-system, cross-agency effort to match participants to an exit location, again with the goal to have no participant return to the streets. And LAHSA will ensure the transition of PRK exit sites, phased with exits taking place at least 6 weeks prior to the end date, and will have moved every client out at least 1 week before the lease end date. So this has been a really massive effort, but has, again, yielded very positive results. So just one last slide on next steps. We are continuing to ramp up our new recovery rehousing subsidies and services to cover all Project Room Key residents. We're actually in the process currently of amending our Corona relief contracts that expire December 30th due to the expenditure deadline to include ESG CV funds to continue subsidies for folks who have moved in and to enable additional people to move into permanent housing. We're establishing a full PRK, Project Room Key demobilization schedule with the city and county that enables success and ensures participant safety. We're making refinements to our ramp down model, and we're tracking and responding to performance with an equity lens. This is, again, an extremely critical approach as we move forward. So with that, I would normally open to questions, but since we're in a weird virtual environment, I will say if you have any questions, I would be happy to answer them, and I'll ensure that the conference organizers have my email, but it's Meredith, or rather M. Berkson, at lahsa.org, and I look forward to connecting. Thank you, be safe, and take care.